Domain 1E. Apply disability etiquette into practice. Recommended study tasks. Describe and follow disability etiquette guidelines for interacting with people with disabilities. Judge the appropriateness of ways of referring to or about people with disabilities. Overview. Disability etiquette is a set of guidelines on how to interact with and communicate about people with disabilities in an inclusive and respectful way. It covers appropriate behavior, attitudes, and respectful language both in direct communication and in reference to people with disabilities. Examples of disability etiquette in personal interactions. Speak to the person directly, not to the person accompanying them. Do not make assumptions about what a person can or cannot do. Since the impact of a specific disability can vary widely from person to person, you should provide assistance only if the person requests it or after you have asked their permission. Acknowledge the person's ability to make decisions and judgments on their own behalf. Respect the person's personal space and privacy. Do not touch the person's wheelchair or other equipment without permission. Inclusive language. People-first language. The most common recommendation is to use people-first language. As an example, it is generally more accepted to use the phrase, "a person with a disability," instead of "a disabled person." People-first language is the form used in the UN Convention on the Rights of Persons with Disabilities. The emphasis is on the person, not the disability, to avoid labeling and stigmatization. People-first language is used in communications by G3 ICT IAAP in line with the UNCRPD. Identity-first language. Some people with disabilities prefer to use identity-first language to refer to themselves. In this format, the emphasis is on disability as a key part of the person's identity. This language is often used by self-advocates within disability communities. In direct communication or when referring to a specific person, it is best to ask the person themselves what they prefer.